Hi Tessa, how are you doing today?
Good, how are you?
I'm good, thank you. My name's Tara, I'm going to be your student nurse today. You can have a seat on the couch. I'm just going to wash my hands and give some privacy. Alright, when you came in I saw that you had a steady gait, you're well groomed, and you're dressed appropriately. I'm going to look at your face. I see that your face is symmetrical. Now, do you have a history of smoking?
No.
Do you have a history of drug or recreational drug or alcohol use?
No.
Are you having any pain today?
No.
Alright, and how do you sleep at night?
I sleep 8 hours a night.
I'm really
Every
glad to hear
night.
that. Alright, that's awesome. Alright, it says here that you're not on birth control. Is that a decision you wanted to make at this appointment today?
I think I'm going to try birth control today.
Alright, I'm glad you can make decisions. I'd like to check some just simple commands. Can you stick your arms out to the side? Take your right hand and touch your nose. Can you take your left hand and touch your nose? Alright, so you can follow simple commands. Thank you. Let's check your reflexes. Can you sit with your knees bent? Thank you. Nice reflexes. Alright, can you tell me where you are right now?
At the doctor's office.
Alright, and do you know the day of the week it is?
It is Wednesday today.
Alright. You can tell that you're alert and oriented times 3.
It is Wednesday, December 4th today. 2013.
Thank you. Again, I can tell you're alert and oriented times 3. That is what we like to see. I'm happy to hear that. Now, this is where I would do my vitals. And since you're a healthy patient, I would get vitals in between 60 and 100 when it comes to your heart rate. I would have a blood pressure around 120/80. And your respirations, since you're healthy, would be between 12 and 16. So, I'm going to do my vitals. And I'm going to check your vision, okay? Do you wear glasses?
No.
No contacts?
No contacts.
Alright, how is your hearing?
Perfect.
Alright, so I'm going to use my pen light. I'm going to look into your eyes. I'm looking for pearl. I'm looking at your pupils to see if they're equal, round, and reactive to light. So you can just follow my pen light. Alright, very good. That was great. Alright, now I would like to, I'm just going to assess your face. I'm going to look for any drainage. I'm going to look at the nose. I'm going to look at the ears. Can you open your mouth for me? I'm looking at your oral mucosa. I want to see it's pink and moist. And your teeth look nice and healthy. Because that's really important. Yeah. Can you, I have a cup of water over here. Can you just take a sip of that? I'm noticing that the trachea is aligned. And I'm going to look at the neck. There's no swelling. I'm going to start inspecting the head. I inspect it. I'm going to look for lesions. I'm going to feel for masses. I'm going to check the neck for any lesions or masses. The skin is warm and dry. So everything looks good there. Alright, now Tessa, if it's okay, I'd like to listen to your heart sounds.
Yeah, it's okay.
Alright, I'm going to start on the right side and listen to the aortic valve. In the second intercostal space. I'm going to move over to the left side, second intercostal space, and listen to the pulmonic valve. I'm going to go down to the third intercostal space to the Erb's point. Then I'm going to go down to the fourth intercostal space to the tricuspid valve. And then slide down to the fifth intercostal space and listen to the mitral valve. While I'm here, I'm going to listen for 60 seconds to the apical pulse. The apical pulse is regular, and I hear both S1 and S2 heart sounds. So, let me also listen to your lung sounds. So I'm going to start on the right side. I'm going to listen to the right upper airway. I'm going to move across, listen to the left upper airway. Move down to the the left middle airway. And across it. Take a deep breath. Thank you. The right middle airway. Then I'm going to move down to the right lower airway. Take a deep breath. And then another deep breath at the left lower airway. I'm going to do the left lateral airway. Thank you. And then the right lateral airway. Alright. Can you tilt back? I'm going to listen to the lung sounds on the back. I'm going to start on the right upper airway. Take a deep breath.
Do you need me to take off my shirt?
This is okay for now. I'm going to check your back after we're done, so then I'll have you take it off. Another deep breath at the left upper airway. Left middle airway. Right middle airway. Right lower airway. Left lower airway. Left lateral airway. And then finally, right lateral airway. The lung sounds are clear. I would like to just take a look at the skin on the back to make sure it's intact. It's warm and moist with no lesions or abrasions. I'm just going to look. I'm going to palpate. Thank you. So it is warm and dry. No lesions, no moles, there's no rashes. Sorry, so now I'd love to go through to the 9 pulses. I listened to your apical pulse, so that one is out of the way. But I'm going to come around. I'm going to listen to your bilateral temporal pulses. I'm going to move down. I'm going to check one carotid at a time. Then I come down to the brachial pulses. And when I'm down here, I can see that her chest is symmetrical when she inhales and exhales. I'm going to come down to the radial pulses and check those bilaterally. Then I would do the femoral pulses. It's okay. And I would check the bilateral femoral pulses. Come down, check the bilateral popliteals. Moving down, I would check the posttibial bilateral pulses. And then finally, I would check the pedal pulses bilaterally. So, all 9 pulses are strong and present. Can you wiggle your fingers for me? Alright, can you squeeze both my hands? Thank you. And I'll try to pull against them. And now can you push against them? Good. Symmetrical. I'm going to check your nail beds. Nail beds look good. I'm going to check the calf refills. For less than 3 seconds. Nail beds are pink and normal skin tones. I'm going to take off your shoes. Thank you. I'm looking at the nail beds. The nail beds are normal tones. They're pink undertones, which is what we want to see for a Caucasian lady. Can you wiggle your toes for me? All right. Can you? Thank you. Can you put your feet against mine? We'll take this. Can you push against them? Thank you. Now can you push it against my hands? Thank you. I can tell that they're both symmetrical.